Alrighty then. Hello everyone. Welcome to Roswell Park's Pediatric Back to School webinar. It's been a while since we've done one of these, right? I'm Rebecca Vogt. I'm the Media Relations Specialist here at Roswell Park Comprehensive Cancer Center in Buffalo, New York. And like I said, I know it's been a little while since we've all seen each other last, and I hope that everyone's had a really wonderful summer and had time to get out and see folks and still stay safe at the same time. Now that September is here, which is so very weird to say that September is here, but nevertheless, here we are. We'd like to virtually welcome you back into our space. Right around this time last year, we held a similar webinar as school districts across our region took the first steps into reopening during an ongoing pandemic. A lot has changed since then, so we figured we'd provide you with an update of what we know now. I am joined by three very wonderful individuals today. The first is Dr. Kara Kelly, a pediatric oncologist and chair of the Roswell Park OSHI Children's Cancer and Blood Disorders Program. Next, we have Dr. Megan Hagen, a pediatric hematologist and oncologist with us. And then rounding out the group today is Dr. Kate Flanagan. Many of you just know her as Dr. Kate, who is one of our pediatric psychologists. Before we delve into any of our questions that we may have today, could each of you share a little bit more about one another? And Dr. Kelly, we will start with you.
Okay, hello everyone, and thanks so much for participating either live or listening to this after today's presentation. As you heard, I'm a pediatric oncologist. My main focus is in caring for children with leukemia and lymphoma. I do lead our program, work with a tremendous group of people from physicians, nurses, psychologists, social workers, child life specialists, et cetera. And we're really here to answer your questions that you have. We know how scary this whole COVID pandemic has been. And so we want to just hopefully address some of the concerns that you have, try to help you get more reputable information and make safe choices for you and your family.
All right, Dr. Hagen, you want to go next?
Yes, I'm Megan Higman. I'm one of the pediatric hematologist oncologists, and I also am part of the bone marrow transplant team. I want to be able to help you guys make some decisions about your families and know what to ask at school, etc. And also realize that I am a mom as well, sending my kids back on the same into that same crazy mix as everybody else.
Dr. Kate.
Hi, so I am Kate Flanagan. I am the pediatric psychologist, as previously been said, and I've been working a lot with our schools over the past 13 years, but really this past 18 months has been a very different experience working with our schools and helping our students and families get back into the swing of things with school. So I am here as an advocate and hopefully can answer some good questions too about how to ease the anxiety of back to full in-person learning for so many of our patients.
Thank you all so much for those introductions. And so really, as many of you dealt with last year, talk about juggling a cancer diagnosis, you've got treatments, and then all on top of that, throw COVID. It's all quite a delicate balance. And especially now, as many of our experts just echoed, many of their districts have opened to fully in-person instruction. And we want to ensure that this school year is less anxiety filled and also as successful as possible for all of your kiddos. And we do hope that we're able to address all of your concerns within the next hour or so. So Dr. Kelly, Dr. Hibbian, Dr. Kate, so we'll start by discussing some common questions that you guys have come across in the clinic. We have a couple of pre-submitted ones, and then we can answer questions from the audience. Anyone who is tuning in, you are more than welcome to submit your questions through the chat feature down below, that little chat bubble, and we will certainly try to get to as many as possible as time allows. And listen in, because your question that you may have on top of mind may get answered, or there may be a repeat that pops in, but also know that this is going to be available to view afterwards, so you can always go through it again. So we'll start with the first, top of mind things, are a couple of the school questions. So first of all, whoever would like to tackle this, how do I know if my child is healthy enough to attend school?
Megan, do you want to take on that question?
I think that certainly. I think that really the question becomes how they are doing with their chemotherapy, if they're still on chemotherapy, if they are able to keep up with the other kids. So very general questions that we ask every year. that aren't actually COVID questions. If you find that the school is, it's moving too fast for the kiddos, then going to in-person right now may not be your best choice, and homebound instruction that many of our kids have been having for a long time is a better choice. The next question really becomes, is my child ready for the virtual option, or is in-person the best choice? And if in-person is probably the best choice for almost every child, as long as the school district is following all the rules and regulations, and how the child is getting to school is also a safe way. Your own car may be much better than a bus if it's at all possible. And so moving through that, is the child first ready for school and the pace, and then is the school following all of the rules and regulations? And it's okay to ask and to keep on them to make sure that the masks are in place, the testing is being done.
Hit the nail on the head there, Dr. Hibbian, because the next question leading into us is, I mean, how do you make sure that said school, that my kid's school is going to be following these proper precautions for my child? I mean, should you be knocking down the doors, giving phone calls? What sort of, proper protocol here?
So, Rebecca, I think in conjunction with that is the idea that not just is the school following the rules, but making the school aware of the patient and any concerns the parent might have, which I think is a place where our psychosocial team often plays a critical role, because we do try our best to touch base with all the schools involved with all of our patients within the first month of school. And certainly at the request of a parent can do that at any point in the school year to make sure that rules are being followed, protocols are being followed, but also to make sure that the school understands the importance of following those rules and the protocols in place, because they may have children in the building who are immunocompromised for a number of reasons, not just always our patients, but other children who might be fighting chronic illnesses as well. So we certainly try to serve as an advocate on behalf of our patients in that capacity, so that parents don't have that additional stress of trying to see what's happening inside of the school building. So that's something we do try very hard to work on with our families.
I also recommend that parents have a one-on-one conversation with the child's teacher just to make them aware. I think that if the other families in the child's classroom are aware that there's a child with a compromised immune system, they're more likely to be a bit better of holding their kid back from school if they're sick, or, really ensuring that the child is wearing their mask. So it's just, I think, other families recognize that it's very stressful for the parent of a child with cancer. And so they will work extra hard to make sure that the child is supported in the classroom.
So last year we saw, parental anxiety through the roof. I mean, it feels like we've been running, with our foot all the way slammed on the gas for quite some time now. And that anxiety level, I don't really think has lessened a whole lot. So that being said, with that sort of lingering, am I putting my child in a dangerous situation, and is it worth it?
Well, I think that fortunately, we've seen that even children with compromised immune systems, if they do become ill with COVID-19, most will recover. The vast majority are able to tolerate it. Again, our first, preference is that the child doesn't get sick at all, and therefore taking the precautions of masking, distancing, vaccinating people that are eligible is really, really important. But if the child does develop COVID, really their immune systems are usually able to handle it. Again, that's not what we want to see, but that's been the experience both at our center, as well as we participate in a national registry where pediatric hematology oncology programs are sharing their experience with COVID-19 so that we can learn from each other. And that's the information that we've learned from our colleagues across the country.
Excellent. Thank you, Dr. Kelly. We know that the county and the region is monitoring rates daily. I know, we get updates here and there from our county executive, the governor, et cetera, et cetera. But if COVID rates in my school district get to be too high, should I consider pulling my kid out from in-person learning?
I think that's a question for all parents, actually. And I think that that's one of the ones that we all grapple with as caregivers that have to come back into the hospital, and what to do about our own children. And I want people to realize that we're all in there for and willing to answer questions. I think the real question comes down to your comfort level with the school again. If you know that the school has been a very good protective environment and you can talk to the teachers, or if the kids are a little bit older and there's multiple teachers, that you're getting the feedback from your own children about what it's like to be in the school, and what's been going on, I think you can then have a better feel for what you should do. And the other thing, and Kate, you can elaborate on this, many of our kids have 504s, which allow them to be moved a little bit more freely than a child who doesn't have one. And so using that and the psychosocial team would be helpful.
Right. So right to that point, Dr. Hagen, just that idea that we do build into the 504 plan, and we have a letter that we provide our families to give to their school, or we send directly to the school, that very specifically states there are certain infectious diseases. Please notify the family if you're seeing an uptick in them. Of course, COVID is one of those infectious diseases. And then we also include in that letter that just there needs to be essentially a pop-off option for some of those children to receive home instruction if, in conjunction with the school and speaking with their primary oncologist, they determine that the child needs to be out of school for a period of time because infection rates are high. And so we've really built on communicating that to the schools as well as to our families, so that they know that that is something that hopefully reduces that anxiety around what happens if the numbers get too high and I get uncomfortable. We've created that system in place already to be able to say, then we're moving toward home instruction. We always encourage families too to make sure that they're having that conversation with their primary oncologist, so that that pathway of communication is open and hopefully the anxiety comes down.
Kate, Dr. Kate, there was one question, and that I think ties into this very nicely, was the difference between home instruction and the virtual BOCES model. That what are we advocating for most of our families?
Absolutely. Yes, that's a thank you for bringing that up. So we have 100% advocated for our families that they receive home instruction, that they do not participate in the remote instruction model offered through BOCES. And the reason being twofold. One is, in the vast majority of circumstances, the patient would then be, I hate to use the word lumped, but lumped in with other students from all sorts of different school districts. And so they lose their own connection with their primary school, and they lose the connection that they would normally have with their peers as well. The other part of that is, if at some point infection rate goes down, child is in a better place in terms of treatment and would like to return to school, if they opt for that remote instruction piece through the BOCES program, the school district then has made a commitment for you to attend that program for an entire year. And I don't know that that was always clear for some of our families as this option was presented to them, but the school district pays BOCES a tuition essentially for students who attend that program, at the expectation they attend the entire year. Whereas if you have home instruction, you're assigned to a teacher who's in your primary school building, who then, is able to have that continuity with the classroom and continuity with peers that you wouldn't necessarily have if you were in the remote instruction program.
Thank you so much for that clarification and for bringing up that important question. Definitely one thing that I'm sure a lot of folks are wondering about, and I'm sure they're asking you about consistently. One other question in the school section before we sort of move on to our next batch of topics. My child is very anxious themselves about germs in school. As a parent, what can I do or say to relieve their fears?
So if ever there was a psychosocial question, right? So I think that there's a few things we do about that. One thing, again, is I really encourage parents and in our patients to have conversations with their primary oncologist, because I do think that so many times the best antidote for anxiety is fact, and being able to share true knowledge and true facts with families, I think, is really critical to help alleviate that anxiety. The other part of that, I think, is pulling in the psychosocial team so that we're working with the child, whether it's child life, myself, or social workers, who are then working with the child specifically around anxiety related concerns, as most of our children right now are, I think all of the kids that we're seeing just in general are very aware of the seriousness of COVID. They're wearing masks. Sometimes they're more compliant than some of the adults that they see out there. So their anxiety is a little bit heightened already. So I think really having some honest conversations with them about what are the real facts about COVID or risk of any infectious disease, and how do we tackle that, and then also reminding them that there are safety measures in place for them, and that if possible, we have been doing some school consultation and school visits, so being able to do that as well so that they can see that we're connected as well, so we're providing good information to them.
It's really just a lot of active communication. It's, again, like just to sum all this section up, it's parents talking with their kids, it's talking with, their child care team, it's effectively communicating with the doctor, I mean, with their teachers and sometimes their classmates too. So communication is what it all kind of boils down to in this area. Now we have a couple of vaccine questions.
I guess just one thing I would add to that. Just know, I think, one thing that COVID has taught us is that it changes on a dime. So, communication is so key, and reaching out as situations change, because we've had to pivot a lot. And I think that it's important for parents, if they're not sure, just reach out and please, please, we're here to answer those concerns and questions.
I'm sure many of the Gen Xers and millennials can understand the pivot reference there. I think that's a Friends reference. If I'm not wrong, if I'm wrong, please tell me. But yes, pivoting and completely being, willing to, drop on a dime and understand these changes, that they are so fluid. So moving right along, I think we have a couple of vaccine questions now that are coming through. So one of the first is, now that the vaccine has full FDA approval, and I think at this point, at least in the United States, it's just Pfizer, and we're waiting on the other two, or two or three, when do we anticipate that it will be ready for children?
Well, the trials are still ongoing. Both the Pfizer and Moderna trials. For Pfizer, I think, is from children ages 5 to 11, and the Moderna 6 to 11. Those trials are anticipated to wrap up this fall. I think the Pfizer may be submitting the data to the FDA later this month. And then it takes a couple of months for the FDA to review all of that detailed information. The FDA wanted to be especially careful with younger children, and so they mandated a longer follow-up period. For adults, it was a 2-month safety period. For children, it's 4 months, so twice as long. That also means twice as much information to have to go through and monitor for side effects. So at this point, we're expecting sometime midwinter, but it is, as you said in the previous segment, it's very fluid. Hopefully it'll be sooner than that, but I think midwinter is what we're expecting. Then children under age 5 or 6 are going to take a little bit longer. Those studies are kind of, a little bit further behind. So I would think probably more like spring for that group of patients.
Now, when this approval, goes through, which I fully anticipate it will, for that under 12 group, have there been any discussions within the pediatric clinic that that the actual vaccine itself and then the 3rd dose booster will be available in clinic, or will our patients have to go somewhere else to get it?
Yeah, so I think first, to address the 3rd dose, we are currently recommending that for patients that are 12 and up, that are either receiving active therapy, bone marrow transplant patients that have other conditions that have caused their immune systems to be compromised, like sickle cell disease. So those patients should either request, or we will be asking them about administering the 3rd dose, and that's something that we can do right in the clinic. Parents can call and schedule an appointment for their child as a nurse visit. So that we're all set to do, right now, and we would encourage people to reach out for that. Once FDA grants the emergency use authorization for the younger children under age 12, we also will be administering that in the clinic, or, a parent can take their child elsewhere, but we will have it. And again, just give us a call and we'll make arrangements.
Kind of a more patient-specific question. One coming in that says, my child's heart is weakened from treatment. How common is myocarditis and pericarditis after getting vaccinated for COVID-19? And should there be any concern there?
I can handle that one. The risk from myocarditis is actually fairly small with the vaccine. Millions of vaccines have been given, and most patients have not had the myocarditis. There is a risk of myocarditis and other effects from the because of the chemotherapy. We're always worried about them, but there's effects of having COVID as well. And so the effects of COVID far outweigh the effects of the vaccine and the risk from the vaccine. There is a small population that we worry about allergies, but we've already worked it out with a allergy group to try to help make sure that we don't have allergy issues with the vaccines.
Yeah, just to add to that, put it in perspective, a recent study that I read showed that you're 6 times more likely to get, myocarditis, inflammation from the heart, from a COVID infection than you are from the vaccine. So it's much better to protect your child with the vaccine than to take a chance on them getting the infection itself. The other thing that I would add, as I mentioned earlier, is that we're participating in a registry that's tracking the outcomes of children with cancer that are exposed to COVID or that get the vaccine. And thus far, the incidence of side effects in teenagers getting the vaccine are extremely, extremely low, and they're relatively mild. They're the headaches, the fatigue, the sore arm, that has been reported, but we're not seeing any serious reactions to date. It's being carefully tracked, so that we continue to learn from it. But thus far, it does seem to be safe for this patient population.
And now for that group, that 12 and up right now, that can get their vaccines, what should parents be watching for after said vaccines? And how are they supposed to know if it's serious enough to then call a doctor or potentially go to the emergency room?
Well, with the myocarditis, the symptoms of that are going to be severe chest pain or shortness of breath, and really severe enough that a parent would notice that it's significant. And in that case, they should call us and discuss whether the child should go to the clinic or to the emergency room to be evaluated. As Dr. Higman said, those cases are so incredibly rare. So it's unlikely to have a problem, but again, reach out to us if there's any concern on how the child feels after the vaccine is given.
And most people don't get the fevers and stuff. Some of the families have said, what if they look sick and you tell us to bring them in because they look sick? Give us a call. We're going to walk you through what that means for your particular child. Is this something new? Does this look like other kids who have gotten the vaccine, or is this truly somebody that we want to see and just put our eyes on?
All right. So as we round out vaccines, just a couple of sort of COVID and also, cold questions as we, head into fall. All these, concerns do start to crop up too and again, with kids starting to share space again in classrooms. It's all very fair points to bring up. This may kind of piggyback off of what you were saying, Dr. Higman, though. What should I do with my child if they are showing any cold-like symptoms? Should I go straight to the ER? Should I call my doctor? Should I call the care team here? What's sort of the process that the parent should go through?
I smiled because we're all as parents, and I'm sure that Kate, who has a young one as well, anybody with a COVID symptom, and those symptoms are a huge number of different symptoms that cross over to other viruses, will need to either have a quarantine or will need to have a test. And so I think the best thing to do is to give us a call and we'll direct which way to go and what we are currently doing, because we keep having to pivot for this as well. If you are vaccinated, even if you have a symptom, even though you're vaccinated, somebody has to clear you back in or you have 10 days at home. And so we need to, I think we're going to be pivoting as we see the numbers rise on whether we test somebody so that they can get back in, or whether we give them an excuse to get back in on any of the symptoms. So it's going to be a problem for our kids who are immunocompromised, but it's a problem for anybody with children right now. Right, Kate?
Right, right. And I think our rules probably stay the same in terms of care too. So I think, as we always tell our families, if your kiddo doesn't look right or they're sick, then call the on-call attending or call into clinic and everybody will walk you right through that process. But yes, I'm sure we'll have lots of COVID testing coming up as the kiddos all get back into shared space.
The other thing I would add, especially for the kids that are 12 and up, is that if they test positive for COVID, there is a monoclonal antibody treatment that could be administered. So, this is particularly for our children that are on active chemotherapy, children that have had a bone marrow transplant, children with sickle cell disease, or other conditions that impact the immune system. So by contacting us, by us helping to arrange for the testing, and then if we identify the child as being positive, we can get them into the clinic. We have the monoclonal antibody treatment there, and that will hopefully lessen the severity of the illness. So keep that in mind for all those teenage patients out there.
All right. So talking about things just sort of floating out there in fall in terms of colds and whatnot, in Western New York, we are seeing cases of multi-system inflammatory syndrome for children, or as many people sometimes see it on paper, MIS-C. Is this something that we should be worried about? And how do we know if and when to go to the hospital?
I think one of the interesting things is that we're not seeing a lot of it right now. We saw a lot more cases in the early spring, kind of right after the peak of COVID in January, February in our community. So again, we'll see what happens, with the fall as the case numbers are expected to go up. But thus far, it's been relatively few cases. So hopefully that won't be an issue for our patient population right now. I think one other thing I did also want to highlight is that despite what people are seeing in the news and in states where there's really, high rates of COVID, especially the states where there's low rates of vaccination among adults and teens, is that our numbers are still fairly low in our community, especially in pediatrics. I looked at the numbers recently, and there were only 3 children hospitalized at Oshai with COVID infection. So, again, we'll have to monitor this very closely. As Dr. Kate said, all these kids going back to school and sharing space, we may start to see those numbers go up. But at least for right now, it isn't a significant, burden to our population.
I know another big thing that also sort of made the news cycle as well at one point, at least in our area, was RSV rates and everything. So you have that, you have like MIS, you have COVID, all of this stuff, all sort of compounded, and you have pandemic fatigue at basically an all-time high. And maybe Dr. Kate, you can take this one on. How does one explain to other children, siblings, that we need to be extra cautious without them feeling guilt or resentment toward their brother or sister in treatment?
So I feel like that's a loaded question. So there's kind of 2 parts to that. Is one part I want to tackle first is that idea of guilt and resentment, if that's okay, because I think that it's really, really common for siblings of pediatric cancer patients, or even siblings of children with other chronic illnesses, to have some degree of resentment, and then they feel bad that they resent their sibling who's going through treatment, right? So one of the things that that we talk about psychosocially is reminding parents that the psychosocial team is here for the whole family, and that we really focus on that whole family system, because they have to survive together as a family system. And so we want to be able to make headway with any of those really, they're unpleasant emotional reactions, right? So we want to head off the guilt and head off the resentment at baseline. Then you add COVID on top of it, and it becomes a whole other bigger issue, which I think for a lot of our families, who've traveled this road for a little bit, siblings are very much accustomed to that increased caution that they take. So, so from that end, it's not too terribly different, I think, from what we've always done, which is we need to be really careful. Now, kind of as Dr. Higman mentioned, I have an 8-year-old at home. She can't be vaccinated, right? So I mean, every day she's like, is today the day? Is today the day? And we're not there yet. So even with her, we really focus on, well, how do you keep yourself healthy? You know, I wash my hands, I wear my mask, I don't get close to people, I'm aware of my surroundings, all of those basic things. So I think sometimes when dealing with siblings, it's as simple as these are things that we do to help you stay healthy. We really, really stay on top of them to make sure that your sibling stays healthy as well. And so that we're not bringing extra germs into the house and those types of things. So I think as much as you can pull it away from the pediatric patient bearing the responsibility of the reason for good health hygiene and focusing it more on the global concept of we should all be washing our hands. It's great we're wearing masks because we're not sharing RSV or cold or flu or paraflu, et cetera, and really focusing on that wellness aspect of things. Then I think we can get rid of some of those feelings of guilt and resentment. But as I said, I also think it's very normal for the siblings of pediatric patients with chronic illnesses to have some degree of resentment and guilt in there. And if it starts to become a problem, that's where you call myself or Dr. Aquilino, and we're going to address that with the family so that we can make that better.
Interestingly, one of the other things is that's really helped my own kids is that we've now spread that empathy towards others. It isn't just the sick patient in our family. What if you don't know about other families? And suddenly my son comes home and goes, did you know somebody's father had a kidney transplant? And so suddenly that empathy is spreading out from just that core family, but everybody's family is affected by this. And I think I've seen some growth in a lot of kids. So being able to spread that out really does help.
All right. One other sort of last thing, I'm not really seeing any questions pop through right now, so we can kind of keep on trucking along with where we've got on our pre-submitteds, but there's some questions about our visitors policy. So what's our current policy on visitors, to which I will note first before anyone says anything, is that I know that outpatient visitation just changed this past Monday on the 6th, and you can take a look on our coronavirus landing page, which is roslowpark.org/coronavirus. There's going to be a drop down thing on the right hand side for visitor policy, so you can read through that there. But anything else you guys want to add on that would be great. And then additionally, how do you find out if the guidelines will change before our next visit/admission? And that, I'm sure, goes back to a lot of the fluidity we were talking about before. I don't know if anyone wants to tackle that, but
Okay. I was going to let Dr. Higman take that, but I think, you know, it's a very fluid process, and we're trying to balance making sure that the patients have the appropriate support, you know, people with them during their visits or admissions, but also trying to decrease the risk of transmission. Fortunately, you know, the hospitals recognize that children, you know, really can't be alone and they require support. So they are allowed to bring, you know, a parent, you know, another adult with them. You know, unfortunately, we can't bring other children into the clinic just because of the risk of transmission. On the inpatient side, because our children are hospitalized at Oshai rather than at Roswell Park, so we do have a little bit more of a liberal process in that we're allowing, you know, a couple of adults to be able to visit with them. But I think the most important thing is that you check if there's any questions you have about who can be there. Just ask our team, you know, when the appointment's being scheduled, or we'll let you know so that you can plan accordingly. I don't know, Megan, if there's anything you want to add to that.
No, I think that's very much what we've been telling families. And don't visit if a parent is sick, then maybe the other parent can come. We don't want to expose the children, the other children on the floor, and we want to be able to have everybody be able to be supported. And so I think one of the most important things is if you're sick, stay home. I tell some of our families, they go, what can my kid not do anymore? I said, you just follow the COVID rules and you'll be okay, and call us if you have a fever. And they're like, is that what we need to do? Yeah, and that's the same for visiting our floor. Don't come sick. But come wash your hands, do the things that we've all been doing. And right now we've been having both parents come. We tell people to go home and make sure they sleep. Kate, is that what your experience has been too?
That has been my experience. And I found that, our families they're just very mindful. They're very mindful of both the risk to their own child, but then the risk to other children up on the inpatient unit as well. So people are following the rules. I would say it's really, really important just to kind of touch base with a team member if a family is uncertain about what the rules are or if they've changed. I know, I feel like even our local media outlets have been useful to some degree with making sure that people are aware that there are changes to visitor policies, which I have to tell you is something I've, in 13 years, I've never seen it before, but they seem to be doing an awful lot of reporting that out too, which I think is also helpful because it flags our families for us a little bit. Um, but I think our families have been okay with the changes too. And if there have been little bumps in the road here or there, our team has worked really hard to make accommodations, to work with families who may have childcare issues and things like that arise. So it's something too that we are aware of. We don't pretend this is easy. We're very sensitive to the needs of our families, but like I said, I think that the policy is in place. It seems to be working, and we're always here to help if a family hits a stumbling block that they can't figure out how to get over.
And I just would again put in a plug, just if parents are not vaccinated, just to consider, because that truly is the best way to protect not only the child, but the other people that they will encounter through the hospital. So, and themselves, even more importantly than that. So we strongly encourage vaccination of all teens and adults that are going to have regular contact with the patient.
All excellent points. And it looks like we got this all sort of wrapped up with a bow in just over 30 minutes. So that's really exciting. But before we go, I do want to give each of you just a chance, like sort of quick round table. Is there anything else that your parents have been coming to you guys with that has not been addressed in the last, half hour or so that we've been talking that you would like to bring up, or any other closing thoughts you'd like to give? Dr. Kelly, I know you just spoke. If you want to just go first, and we'll kind of go down the line.
I think I just want to reiterate the importance of communication and reaching out if you're not sure, if you need some guidance. Your child's primary doctor is really knows your child the best and can help advise you as to what is most appropriate for your child. If you're hearing other things that conflict with information that you might have heard in the clinic, again, just reach out to us. If you're concerned your child isn't well, we really are here for you. There's always a doctor on call 24 hours a day. And given, what a scary, unpredictable process this has been, we just encourage you to reach out with any concerns that you may have.
I think that one of the things that I find most from families that are asking is how, is the shot. And I think I want you to feel comfortable coming forward and asking questions about the shot, about what you've heard, about the fertility questions, about what's actually in the vaccine, those kind of things, so that we are able to talk to you about those issues and make sure that we can have you be an informed consumer so that you can go tell grandma and grandpa why it's important for them to get the vaccine, why it's important for them to be safe so that they can come visit their grandchild. I don't want grandchildren not to see grandparents because we have information that's not correct. I want it to be that everybody can come together.
Dr. Kate, any closing thoughts?
I think I cannot stress enough, as Dr. Kelly and Dr. Hagen have said, just, make sure you're talking to your provider to get accurate and up-to-date information. And I think that as we've talked about that concept of pivoting, I think it's important to recognize that sometimes the information changes, and it changes as we get more information, more data, more science to support the different stances and policies that are in place. So I think that that's a really important thing for people to remember. And as everyone has said, you have a question, pick up the phone and call. That's what we're here for. And we are here, 24/7 for on-call hours and everything else. We want to be able to help guide this process, reduce anxiety, and keep everyone safe.
Absolutely. I mean, and I think all of you have made a really good point to that. Our patients and our youngest patients and their families have already been so good already handling all of the precautions that they had to take in place with the cancer diagnosis and everything that goes along with it. So they're pretty used to rolling with the punches as is. So kudos to all of you out there who are tuning in. And I mean, just keep being resilient and just and patient as well as we just kind of foray into these variants and everything that's coming up with COVID and any and all updates that we do get as it relates to not only our adult population, our pediatric population. We will put it out there for you so that you're not misinformed and that you're getting the right information out there to your loved ones. And with that all being said, I do want to kind of wrap out and close myself and thank all three of our experts today for taking time out of their busy schedules to join us. And if any of your questions were not answered, or if you have any sort of specific concerns, we're going to suggest that you reach out to your child's oncologist or psychologist, the care team here at Roswell. And a couple of sort of final housekeeping notes: that the recording of this webinar is going to be emailed to you, and we're also going to be posting it on our page for on-demand viewing, and I think also on YouTube as well. We tend to do that with these webinars. The landing page that you registered on, roswellpark.org/pediatric webinar, should have this latest recording very shortly. So please feel free. Again, if you have some friends who have patients here who have not watched it, give them a little nudge and say, hey, here it is, tune in. We appreciate you sharing this information as far and as wide as possible. That being all said, everyone, I wanted to thank you again for tuning in. Have a wonderful day, and we'll see you next time. Bye, everyone.